Delirium News. My name is Max. Heroin came about to help people fight morphine addiction, originally developed in 1874, but not produced commercially until 1898 by the Bayer Company to help combat morphine addiction and cough suppressant. Heroin was legally purchased in the U.S. until 1920, when the U.S. enacted the Drug Act to stop the legal production and selling of heroin. Heroin is an opioid drug that is synthesized from morphine, a naturally occurring substance extracted from the seed pod of the Asian opium poppy plant. Heroin usually appears as a white or brown powder or as a black, sticky substance known as black tar heroin. Now, to our investigative reporter, Sarah, in the field.
Hi, I'm Sarah with Delirium News, here to report to you about the location of growth of heroin, types of heroin, and ways to get high with heroin. First, I'll talk about the location of growth. Opium poppies are grown primarily in 3 geographically distinct regions: Southwest Asia, Southeast Asia, and Latin America. In addition to these 3 major regions, legal opium poppies are cultivated in government-related opium farms in India, Turkey, and Australia, among others. The Golden Crescent, a region encompassing Afghanistan, Pakistan, and Iran, represents over 80% of global opium production, with Afghanistan's annual production potential for heroin hitting over 600 tons in 2014. Of the 3 areas, Mexican heroin continues to be the most abundant heroin in America today. Types of heroin previously mentioned by Max are diamorphine base, also known as brown heroin. This is the first stage of purification of impure diacetylmorphine. Also, diamorphine hydrochloride, commonly known as white heroin, is the most refined heroin on the market. The purification process involves ether and hydrochloric acid. Lastly, black tar heroin is a dark, sticky, resinous substance of Mexican origin. It's generally cheaper and faster to produce than white or brown heroin. Now we'll discuss ways to get high. Heroin is administered into the body by injecting it directly into the veins, smoking it, or snorting it.
I'm here to introduce to you Spider. Spider, you can see how desperate he has become, becoming a heroin addict, and what he's willing to do to get that drug. Here's a day in the life of Spider as he's injecting himself with heroin.
Now to Lorena on the medical aspects of heroin addiction.
Since opioid receptors in the brainstem control breathing, we see many overdosing victims in the hospital that exhibit a decrease in respiration and hypoxia to the brain, which leads to coma and permanent brain damage. Heroin drug users are also very prone to HIV, Hep C, infections that are transmitted within the blood, which occurs when they're sharing needles. At the hospital, the most common stage that we see people in is the chronic users, because they develop collapsed veins from injecting heroin, endocarditis, which is the inflammation of the heart abscesses, pulmonary complications like pneumonia and tuberculosis. Street drugs are especially dangerous because they contain additives that clog up the blood vessels, which leads to organ damage. Many women we see that are heroin drug users occur to have spontaneous miscarriages. So if any of your loved ones are suspected as drug users, refer them to programs that help with addiction.
The story from Minneapolis and St. Paul is heroin. We have an emerging heroin problem, the likes of which has never existed before. The primary demographic of heroin users in the Twin Cities tend to be young, largely suburban males. About 40% of people coming into treatment for heroin are between 18 and 25 years old. Our deaths keep going up. Our treatment admissions, coupled with admissions for other opiates, now account for 1 out of 5 people coming into treatment, which is second only to people coming into treatment for alcohol. This has never been the case, and historically in the Twin Cities area we have never had an entrenched narcotic-addicted population. So everyone's on a learning curve about what to do about it and how to best address it.
Now to our investigative reporter, Erica, at the treatment facilities.
Hi, so I'm here to cover the medical treatments for heroin addicts. There's numerous types of treatments. One is methadone, which is a pill form, which binds to the same receptors that heroin does. Then we have naltrexone, which is a long-acting treatment given by injection, and it's under medical supervision. It's also used as an antidote for heroin overdose. Then we have behavioral therapy, which focuses on counseling and supportive meetings. And now I'm going to present a clip of a treatment center.
The first step is detoxification. This can mean completely stopping all opiates or taking decreasing dosages of long-acting prescriptions to ease withdrawal symptoms and reduce cravings. Medically supervised detox is more effective as well as less uncomfortable than going it alone. Doctors can prescribe medicines to help ease the discomfort associated with withdrawal from both heroin and other substances often taken by heroin users. This is usually done on an inpatient basis. Ongoing medical maintenance is a tried and true approach to staying off heroin. Since the 1960s, countless people have found success through methadone, which activates opioid receptors in the brain but has a milder, longer-acting effect. This enables people to avoid withdrawal symptoms without heroin's many negative effects. Due to the potential for abuse, methadone is only available by daily visiting a specialized clinic, but newer medications that are formulated to reduce abuse potential are now available. These include Suboxone, which not only reduces withdrawal symptoms, but also blocks the effects of injected opioids, and Vivitrol, which is given once a month by injection. It's non-addictive and non-sedating and blocks the effect of opioids, making heroin ineffective and unappealing. But medical therapies alone are rarely enough. The best approach includes behavioral treatment to address underlying emotional and psychological issues that may have led to heroin use in the first place, along with issues that have developed due to heroin use. A support system of recovering people, family, friends, and treatment professionals is also essential to a lasting, gratifying recovery. To learn more about heroin addiction treatment, visit the Information Center at blakerecoverycenter.org or carrierclinic.org.
Unfortunately, extreme cases of misuse of this drug occurs in human trafficking to subdue its victims. If victims of human trafficking are ever found and rescued, they must still go through the rehabilitation process. Thank you for tuning in to our segment on heroin. From all of us to you, good night.